Hello, this is Dr. David Greene, CEO of the Washington Pain Network. Today's topic is 5 things to ask yourself before undergoing elective back surgery. Over 600,000 low back surgeries are performed every year in America. Half, unfortunately, will not obtain the desired outcome, and 10% will actually end up worse than before the surgery. So the first consideration is whether or not you should seek a second opinion. A second set of eyes may be indicated because it usually is a big decision. Now, the spine surgeon, whether it's a neurosurgeon or an orthopedic spine surgeon, there's a huge overlap now in what they do, but the person may recommend the same surgery, they may recommend a completely different surgery, or they may recommend no surgery at all. Okay? Second consideration, have you really tried all conservative options before undergoing the decision? Now, physical therapy, chiropractic treatment, spinal decompression therapy, acupuncture, various types of medications, and then interventional treatments. All of these may provide excellent relief, and a lot of them can be repeated if they work well and then fail to provide long-term relief. But you really want to be able to look at yourself in the mirror and say, I tried everything I could before undergoing the procedure in case something goes wrong. The third consideration is a risk-benefit assessment prior to the surgery. No spine surgery is risk-free. No spine surgery is bloodless. There's always going to be something that you have to compute with as a variable for a potential complication. For instance, adult scoliosis procedures have over a 50% complication rate. This may be anything from an infection or something minor to something major, such as death. Could be ridiculous amounts of bleeding, nerve injury, anesthesia risk, failure to fuse, scar tissue. On the other end of the spectrum, you have something like a laminectomy, okay, without hardware. There are some minor risks there, like a dural tear or an infection, but the risk profile is smaller, but still you have to consider these types of things before making that decision. The fourth consideration is to really give yourself a reality check on the potential outcomes. Half of back surgeries do not end up with the expected outcome, 10% end up worse. If half of your pain goes away from the surgery, is that good enough? The example is the FDA study on the lumbar artificial disc. Here's the lumbar artificial disc. Okay, this FDA study was done back in 2003 and 2004. Essentially what they found is they compared that to a fusion, and over half the patients at 1 year were still on narcotic medications with either group. Okay, so nothing is perfect. It's not usually a home run no matter what surgery is undergone, and therefore you have to sit there and look at the potential outcome and say, is this good enough? If a few years go by and the surgery only took away 30, 40, 50% of my pain, am I going to be okay with that? The fifth consideration is timing. For elective surgeries, which is what most back surgeries are, you can pick the best time. If you're a child looking at adolescent idiopathic scoliosis procedure, this may be spring break or the summer break. Could be a sabbatical from your work. Rehab considerations for a simple lumbar laminectomy, you're looking at about 6 to 8 weeks. This does not mean you won't be able to go back or work or walk or drive in that time frame, but overall that's pretty much what you're looking at. When you have a fusion, the typical scenario is 3 months. For 3 months, you probably won't be able to, run or swim big time, things like that. But you should be able to start going back to half days at work, after a couple weeks and move back into life. Adult scoliosis is the longest rehab, 6 to 9 to 12 months. It just is a lot of a surgery for an older individual to take and a lot to recover from. So timing is important. The bottom line is the objective is to feel comfortable with the decision, even if surgery does not produce your desired outcome. It's reasonable to work through these 5 considerations to make sure it's the right thing for you. The top non-operative pain management in the state of Washington is with the Washington Pain Network. The network works with quite a few clinics. There's over 50 insurances accepted, over 25 treatment options provided, and over 90% success rates on average are achieved with the board-certified, award-winning doctors. Call us today at 877-877-8556 and visit us online at WashingtonPainNetwork.com. I'm Dr. David Greene with the Washington Pain Network. Your pain stops here.